So I hope this is visible for you. The endocrine system. Okay, so here there are a lot of disease conditions in this endocrine system, but we are going to focus on the hormones in these endocrine system. Usually, a direct questions are usually seen in case of endocrine system. So yeah, this class will be very beneficial for you to gain up to 3 questions on your prometric examination. So we can expect 2 to 3 questions directly from the endocrine system. Fine. So, what is an endocrine system? Endocrine glands or an endocrine system are those glands that doesn't have any duct, which means that the endocrine glands will release its hormone directly into the bloodstream. And we have the exocrine glands. What do you mean by an exocrine gland? The exocrine glands are those glands which doesn't have any duct. It'll usually, sorry, exocrine glands are those glands which are having ducts. It'll usually secretes its secretions into an gland. Further, it will be released from those glands. Example: salivary glands, tear gland, and other glands, sweat glands. Yeah. So and there are again the third one, which is known as a mixed gland. So the mixed gland means the gland which is having both the functions of an endocrine gland as well as an exocrine gland. Example is pancreas, where the head portion of this pancreas, head and the body portion of the pancreas is an exocrine gland, where it produces hormones, where it produces these enzymes, hormones, and it stores in the place. And there is a tail portion of the pancreas which is which is having the function of an endocrine gland, which releases the hormone from its beta cells as well as alpha cells directly into the blood. So this is how the pancreas works, and it is known as a mixed gland. Now moving on to the endocrine glands. The main endocrine gland is the hypothalamus will be secreting two hormones. Yeah, hypothalamus will be secreting two hormones, right? Which are those hormones? See, we have oxytocin as well as the vasopressin. The two hormones are secreted by the hypothalamus, the oxytocin as well as the vasopressin. Clear? Now, the oxytocin as well as the vasopressin secreted by the hypothalamus are stored in the posterior pituitary, and the posterior pituitary releases these oxytocin as well as the vasopressin. Now, this is the oxytocin as well as the vasopressin. What is the function of the oxytocin? It is otherwise known as love hormone. Why it is called as a love hormone? Because during sexual intercourse, or if you are feeling crush towards a person, these oxytocin hormones are released, and it helps in the contraction. Okay, like uterine contraction, then penile contractions, ejaculation. These oxytocin helps. So, when these oxytocin are increasingly secreted, it leads to a condition known as BPH in males. Okay, benign prostate hyperplasia. And if there is a if there is a decrease in the oxytocin, it may leads to an autistic condition. Okay, autism is a neurological condition which focuses on these motor skills. Okay, this oxytocin deficiency will lead to an autistic diseases. Second one is the vasopressin or the ADH hormone. So you know that well, right? So when we were talking about the renal system, also we have emphasized on that. What is in vasopressin and what are its functions? It mainly regulates the water, or it maintains the water balances. When the ADH hormone is decreasedly secrete, it leads to edema. So yesterday we have looked into edema. Edema is an extracellular fluid shift which is seen in between the cells or an interstitial cells or interstitial space. So those are known as excessive. Those are the conditions in which when the excessive ADH is secreted, it leads to edema. And what is the deficiency? If there is a deficiency of ADH hormone, it leads to diabetes insipidus. Fine. So those are the two hormones. Now, see this one. This is your normal what? This is your normal prostate gland. This is the condition where the prostate gland's size increases. So what is the condition? An excessive this oxytocin hormone. And another, there are some local conditions which is affecting with the genetic predisposed factors, some testosterone level. All those things may happen. So the benign prostate hyperplasia, it's a benign condition. It's a cancerous condition, yet it's a benign condition. It doesn't what malignate. Okay, so that is benign prostate hyperplasia. And what are the main side effects of this benign prostate hyperplasia, or not the cause, the clinical manifestations? The clinical manifestations of benign prostate hyperplasia is that, see, you can see the size of the urethra here. The size of the urethra is more, where in this condition the size of the urethra is less. So what is the main clinical manifestation? It leads to decreased urine output. Okay, urine output will be decreased. Likewise, there will be UTI. There are recurrent chances of UTI. Fine. Then there will be pain while urinating. The person will be feeling pain. Then post-voidal urine will be present. Post-voidal urine. So what is post-voidal urine? When you void, the bladder should be emptied. If there is no if the urine is not emptied properly, there will be residual urine present. So that is known as a post-voidal urine. So increase in the size of the increase in the amount of urine will be present in the bladder. Then reverse see reverse condition will occur. So here we have the ureter. Urine may go back to ureter and it may cause hydronephrosis. Okay, hydronephrosis. Hydronephrosis may be clear. Next, what is the management? The medical management. Urimax. Urimax is the drug of choice. Okay. It is tamsulosin. Urimax is tamsulosin. Tamsulosin 0.4 mg. That is the drug, the medicine. Tamsulosin or the Urimax. Clear. Now, this BPH is again divided into stage 1, stage 2, stage 3, as well as stage 4. How will you diagnose BPH? There is a per rectal examination. So there is a per rectal examination, and when we insert the your fingers per rectally, and when we'll press on the urethral portion and the upper portion, when the patient will be in the dorsal position, or patient can be in the doggy's position, in any position, dorsal recommended position or Sims lateral position, in any position, if we insert the finger and you have to give pressure on the anterior aspect of the urethra. So when you palpate at this anterior area, you can feel firmness. Usually there won't be any pain. So when we pressure the when we keep your pressure, or when we check the, you can feel a hardness right over there. Okay, so in the that is a condition where you can see there is a BPH. So this is a per rectal examination. Otherwise, we can go for the best method is you can go for an ultrasonography. So in the ultrasonography, we can see there is an increase in the size of the prostate gland. Okay. So this is a surgical condition. Urologist usually do the surgery. So the surgery, the BPH is the surgery is TURP. Okay, this TURP, transurethral resection of the prostate. Okay, transurethral resection of the prostate. You'll do the transurethral resection of the prostate. Now, how the transurethral resection of the prostate is done? Usually, the urethral resections are done by inserting a cystoscope as well as the urethroscope through your urethra. And I think I have explained this BPH, right? So within the 45 minutes is the time slot for this BPH. I think I have explained all those things. So this is how the TERP is done. Okay. Now this is the autistic behavior, autism. Okay. See, edema. And then again, we have two types of edema: pitting edema, pitting edema, and non-pitting edema. Okay, there is pitting edema and non-pitting edema. Pitting edema plus, double plus, triple plus, four plus, it's like that. What is the difference between pitting and edema and non-pitting edema? See, when we press on an area of the edema, which you can see, if the skin is recoiling, if the skin is recoiling and maintaining its position, which was normal, within no time, that is known as non-pitting edema. Okay, that condition is known as a non-pitting edema. Other condition, if we are keeping the what pressure over an area and the skin is not recoiling, okay, when the skin is not recoiling, that condition can be called as no, pitting edema. Okay, the skin have to recoil, right? If the skin is not recoiling, it is called as a not if the skin is not recoiling, it is called as a pitching edema. And when the skin is recoiling, we can call it as a non-pitching edema. Clear? Sh- Now, so that was the two conditions, oxytocin as well as a vasopressin. Next, we have the pituitary gland. Clear? What about the pituitary gland? Let us see. See the hormones, its functions, and the first one is first one is ACTH hormone, adrenocorticotrophic hormone. Okay, so this adrenocorticotrophic hormones are secreted by the anterior pituitary. All these hormones are of anterior pituitary hormone. Okay, anterior pituitary hormones. ACTH and the adrenocorticotrophic hormone. And what is its function? It stimulates the production of the cortisol. Okay, cortisol. See, this cortisol is produced by the suprarenal gland, right? Suprarenal gland or your adrenal gland. Adrenal gland produces the cortisol, but the ACTH stimulates the production of cortisol. If this if this ACTH is not produced, the adrenal gland won't produce the cortisol. Okay, so the suprarenal gland won't produce the cortisol when there is a deficiency of ACTH hormone. Okay, so in the ACTH hormone, it what does it function? It stimulates the production of the cortisol. Right. So second one, if there is an excessive increase in the hormone, it may leads to Cushing's disease. Okay, when there is an excessive increase in the hormone of adrenocortical condition, it may leads to a Cushing's disease. Second, if there is a deficiency, it leads to an adrenal insufficiency. Okay, if there is an excessive Cushing's disease, i- if there is an Cushing's disease, it is due to the excessive production, and in case of deficiency, it leads to an adrenal insufficiency. Next, second hormone is TSH, the thyroid stimulating hormone. Correct. When the thyroid, when the thyroid stimulating hormone, what is its function? It stimulates the thyroid gland, right? Two conditions. If there is an excess, hyperthyroidism, which is grave disease, and deficiency, hypothyroidism or cretinism. Clear. Third one is a growth hormone. What is its function? It helps in the growth. We have two conditions if there is an increase in the production of hormone. When there is an excessive production of growth hormone, it leads to two conditions, which is known as a gigantism, and the second one is an acromegaly. Clear. So, what is gigantism and what is this acromegaly? See, suppose this is your bone. Okay, specifically this area. Okay, specifically at this particular point, we have the epiphyseal plate. Epiphyseal plate. Okay, epiphyseal plate. See, it's pH. Epiphyseal plate. So, when when you attain an age of 13, 14, okay, at that point when the growth hormones are excessively produced, you may go into a gigantic condition. Your height increases 6 feet, 7 feet, 8 feet, and so on. Okay, so that is properly before the fusion of epiphyseal plate. Okay, before the fusion of epiphyseal, that is a main point. Before the fusion of epiphyseal plate. So when you have then gigantism, gigantism is due to the excessive production of growth hormone before the fusion of epiphyseal plate. Okay, and assume this condition: if your bones have been fused, okay, the epiphyseal plates have been fused, which means then no long bone growth happens. Okay, in that condition, no long bone growth happens. For example, after your age of 20, 25, at the age of 20, 21, your epiphyseal plates it fuses. Okay, now if your growth hormones are produced excessively after your age of 22, 25, what happens? The epiphyseal plates are fused. Then there is no scope for to increase the size of the bones. Correct? There won't be any increase in the size of the bone. Rather than it will cause the increase of small bones. Okay. That condition is known as acromegaly. So, what is the main difference between gigantism and acromegaly is that in gigantism, the excessive growth of hormone happens before the fusion of epiphyseal plate, whereas in case of acromegaly, the growth hormone excessive production happens after the fusion of epiphyseal plate. Got it? So that is the main that is the main difference. Now, when the growth hormone is secreted less, or when there is a deficiency of growth hormone, it leads to a condition known as dwarfism. Clear? Now, the fourth hormone, which is a prolactin hormone. Okay, so what is the function of the prolactin? Milk, breast milk production, right? Then excessive, when there is an excessive prolactin hormone, men also will milk from through the nipples. Okay, so that is the excessive production when there is an increase in the prolactin secretion. Then the deficiency of prolactin will leads to hypoprolactinemia. In some mothers, at the time of delivery, there will be decrease in the prolactin, which further leads to decrease in the milking of the mother. Okay. Fifth condition, fifth hormone is your FSH, follicle stimulating hormone. Okay. So what is FSH? The follicle stimulating hormone will help in the sperm production as well as the estrogen production. Okay. So the follicle stimulating hormone helps with the sperm production as well as the estrogen production from the ovaries. In both conditions, if there is an increase in FSH, if there is a decrease in FSH, in both condition, it leads to infertility. Right? It leads to infertility. Now, see, in case of IVF, in vitro fertilization, and this kind of conditions, the FSH, the LH, and an anti-Mullerian hormone. Okay. Those three things are usually checked in males as well as actually in males. Anti-Mullerian hormones will also be checked. So kindly note, along with FSH and LH, an anti-Mullerian hormone is also checked. So sixth one is luteinizing hormone. So what is the function of luteinizing hormone? It stimulates the ovaries and uh, it stimulates the testosterone. The test is to produce testosterone. Okay, that is a function of LH. So LH will support the FSH. Okay, so if there is an excessive LH, it is said that there will be increase in the sexual drive, and if there is decreased, it leads to an infertility. Seventh one is melanocytic stimulating hormone, which causes pigmentation on the skin. Okay, so this condition, moon phase, were in case seen in adrenal deficiencies. See, hypothyroidism and Graves' disease. You have heard about the term goiter, right? Goiter. So exophthalmic goiter, when your eyes will be bulb-like, the protrusion of the eyeballs will happen. Myxedema, you heard about myxedema coma also, right? The toxic multinodular goiter, there will be Hashimoto's thyroiditis in that conditions. Okay, see, this is a condition which is known as gigantism, increase in the size. This is a condition which is known as acromegaly. So you will be very familiar with this person, right? Khalid, the great Khalid. So see his jaw lines, his nose, his cheekbones, his forehead. All these bones will increase in its size. Okay, so that is acromegaly. See this condition. This is dwarfism. It decreased size. No, pigmentation. See, you can see the pigments right away, right? Ah, so the melanocytic stimulating hormone due to the increase in the melanocytic stimulating hormones. Third gland. Okay, first one we were looking on the hypothyroid. Sorry, the hypothalamus. Second one is the pituitary gland. Third one is the pineal gland. So all these three glands are situated in your head itself. Okay. But it releases melatonin, which helps in the sleep hormone. See, I have seen one or two questions in which the pituitary, in this the pineal gland have been asked on this in the for your prometric examination. So the questions was asked regarding the sleep wake cycle. Okay. So which hormone was responsible for the sleep wake cycle? So which is melatonin, which otherwise known as a sleep hormone. Now we have thyroid gland. See, the questions will be not asked what is 3T and 3,4. The questions will be asking on triiodothyroxine or the thyroxine. Okay. Full names of the hormones are used. Triiodothyroxine. Tri means T3, right? That three. Triiodothyroxine as well as thyroxine, T3 and T4. So what are its functions? Both the T3 as well as the T4 helps in the metabolism. Okay. If there is an excessive triiodothyroxine, it leads to Plummer's disease. Okay, this triiodothyroxine, if it is excessively produced, it leads to Plummer's disease. And if there is a deficiency of T3, it leads to Hashimoto's thyroiditis. Okay. Now, see, this is what is how you have to see it in the Hashimoto's thyroiditis and in the Plummer's disease. In the Plummer's disease, it's for a longer duration. Okay, there will be a secondary thyroiditis also can be nodules will be very inactive, but there will be intranodular tissues overactive. Now, parathyroid gland. What is a parathyroid gland? The gland which is just posterior to the thyroid gland is known as a parathyroid gland. Two hormones, just two hormones are secreted by a parathyroid gland. This calcitonin and parathormone. Okay. See, this is your blood. Okay, this is your blood, and suppose this is your bone. Hmm? Calcium will be there. What is the function of calcitonin? The calcitonin will take calcium from the blood and deposit it in the bones or in the teeth. Okay, or in the teeth. That is the function of calcitonin. What is the function of parathormone? Parathormone will take calcium from the bones and teeth and deposit it in the blood. Okay. If there is a excessive parathormone, leads you to hypoparathyroidism. Deficiency, hypo. Calcitonin, if there is it leads to a bone cancer. If there is a deficiency, it will be leads to osteopenia and tetany. Right? What is chopstick sign? I have said you to check it. Anybody? Anybody is having any answer for the chopstick sign? Fine. So this is about the parathyroid gland. Next, the tetany. This is how we have to elicit in case of the chopstick sign. So this is what we were talking about. The calcium from the blood will be taken and it will be deposited inside the bones as well as the teeth, whereas the parathormone will take the will take the calcium from the bones as well as the teeth to the blood. So if there is an increase in the calcium in the blood, the calcitonin will be activated, and if there is a decrease in the calcium, the parathormone will be activated. Okay. Now the thymus gland. This is thyroid. Okay, this is thyroid. This is thymus gland. This thymus gland. So the thymosin is produced by the thymus, which boosts the immune system. Okay. Usually, it is mainly seen in children, newborn children. In adults, these thymus are functionally inactive. Next, we have the suprarenal glands, the gland which is just above the kidney. That's why it is known as a suprarenal gland. Okay. And the coverings of the suprarenal gland. We have zona glomerulosa, zona fasciculata, zona reticularis. Okay, but let me remind that is not the major part. This is the major part. Okay, see the cortex are suprarenal gland. The suprarenal gland is having two layers: outermost cortex and innermost medulla. Fine. The innermost medulla is having two secretions, adrenaline and noradrenaline. Okay. Your innermost layer is having two secretions, which is known as adrenaline as well as noradrenaline. Right. Next, the cortex. The layers of the cortex or the cortex is again divided into three layers or three parts: mineralocorticoids, glucocorticoids, and gonadocorticoids. So the name gonado itself indicates has to something to deal with the gonads. So testosterone, this is E, testosterone, spelling mistake. The testosterone and the estrogen. Okay, so we have two gonads, testosterone and the estrogen. Clear? That's about the adrenal cortex. The uh, the gonads in which we have testosterone and the estrogen, whereas the glucocorticoids produce cortisol and the mineralocorticoid produce aldosterone. Clear? The mineralocorticoid produces the aldosterone, the glucocorticoids produces cortisol, whereas the gonadocortisol produces testosterone and estrogen. This is important, so you may get some questions on this. Direct anatomy can be asked. Now, what are the functions? The aldosterone will regulate the blood pressure. You know the renin-angiotensin aldosterone mechanism. When we were dealing with hypertension, we have spoken about this renin-angiotensin aldosterone mechanism. Okay. So, what is the function of renin-angiotensin aldosterone mechanism? It regulates the blood pressure. Okay, when it regulates the blood pressure, like it regulates the complete heart functions also. Now, if there is an excess production of aldosterone, it leads to hyperaldosteronism. If it is if there is a deficiency, it leads to hypoaldosteronism. Clear? Next is cortisol. It suppresses the immune system. See, when a patient comes to you with severe rashes due to a bee bite, okay, what will we give? We'll give injection avil as well as we'll give injection hydrocodone. So hydrocodone can decrease its immune response. Clear? And when there is an excessive cortisol are produced, it leads to a condition known as Cushing syndrome. The cortisol, when excessively produced, will leads to Cushing syndrome. Kindly write it down. And if there is a deficiency, it leads to Addison's disease. Next is the third one is the sex hormones. We have testosterone as well as the estrogen. Now, adrenaline as well as noradrenaline. You know the fight and flight response. So immediately for the fight and flight response, we have adrenaline. And the atropine supports it. Okay. Sorry, the noradrenaline or the epinephrine as well as norepinephrine. Adrenaline is otherwise known as epinephrine, and noradrenaline is otherwise known as norepinephrine. So this epinephrine supports it. Now the pancreas. See, in the pancreas, we have islands of Langerhans. In the tail portion, we have islands of Langerhans. These islands of Langerhans are having two cells, these islands of Langerhans are having two cells, which is alpha cell as well as beta cells. The alpha cells produces glucagon and the beta cells produces insulin. See this picture. The insulin will decrease the blood sugar level, whereas the glucagon will increase the blood sugar level. Okay. Like how we have studied calcitonin and paras hormone. Same. Now we have the gonads. So male gonads as well as the female gonad. Which is the male gonad? It's the testis, right? In the female gonads, the urethra. Okay, the male gonads, the male gonads, the testis produce the testosterone, whereas the female gonad ovary produces what? The estrogen. One more point. The testosterones are produced by the Leydig cells of the testes. So it leads to what? Hair formation, hairs in the pubic area, on the face, chest. So on. Then face sound changes will be there. The person will be having voice changes. So secondary, these are known as the secondary sexual characteristics. So when there is a change and when there is an increase in the secretion, usually and gradually there will be change in the the secondary conditions also. Now, when in case of a menstruating lady, in case of a menstruating lady, her shop, her face won't be. Uh, See, in case of a menstruating lady, the face will be very clear without any wrinkles. Soon after she stops menstruation, okay, the granulosa cells won't be produced. There will be a decrease, very rapid decrease in the estrogen hormone, which may affect the skin glow, as well as there will be formations of wrinkles on the skin. Okay, now we have temporary exocrine glands. Okay, the temporary exocrine glands are, first one is corpus luteum. So what is a corpus luteum? So corpus luteum is when your egg is produced. Okay, when your egg is produced, the egg will be having a covering. Okay, so that covering is known as Graafian follicles. Hmm? So when the Graafian follicles are produced, or when there is a Graafian follicles, or when the egg is released, the egg will go into the uterus and the Graafian follicles remains there. Okay, so when the egg is combined with the sperm, or when the fertilization takes place, this Graafian follicles will convert itself into corpus luteum. Okay, and till the functioning of the placenta, the corpus luteum will be acting as a temporary gland, and it will release the hormones. Human chorionic gonadotropin (HCG), which we'll check in the urine pregnancy kit. Okay. So second one is placenta, the human HCG as well as HPL, human placenta lactogen. So those are the two hormones which are secreted by the temporary glands. So this was all about the endocrine glands. So are you having any doubt on these endocrine glands? Anybody?